please.
Well, thank you very much, Mr. Chairman, and thanks so much for our panel of witnesses for being with us today, because it is so important for the work that you're doing and getting this message out. Ms. Stewart, if I could start my questioning, I'm also concerned for soon-to-be mothers and new moms that live in our rural areas of our country. And the national data indicates that more than half of all rural U.S. counties are without hospital obstetric services. With an increase of women dying due to pregnancy-related complications, how does access to care and hospital services affect pregnancies and postpartum recovery? And is this issue exacerbated for women in our rural communities?
Thank you very much. It is a very serious issue, and thank you for the question. And as I mentioned in my statement earlier, the March Times is working currently on a report that would really show this issue of maternity care deserts. The issue of the closing of community hospitals in rural areas has been well documented. I think one of the things that we're missing is that it's not just the closing of hospitals, it's the closing of hospitals compounded by the lack of obstetrical services and OBGYNs, the lack of midwives and doulas in areas, the distance that women often have to travel just to receive care. And it's particularly acute, not just in rural areas, there's a major challenge, but one of the things we're looking at is even where in urban areas there can be maternity care deserts as well. I'll give you a good example of this. Here in the District of Columbia, there is no hospital that provides obstetrical services east of the river in wards 7 and 8, so east of the Anacostia River. Tens of thousands of women who live there who have no hospital to go to, who then have to travel. If they have no transportation, they have to go on the metro, often an hour or more, to even go to a prenatal visit. If you're a high-risk pregnancy or you have a high-risk pregnancy, the complications that are then exacerbated, or the complications that can result because of that distance, because of that lack of access, is increased significantly. So one of the things that we need to really talk about in the system is the fact that even in the District of Columbia, for example, where there may be the number of beds may be sufficient for the number of women, that doesn't mean that those beds or that care is available to all the women that need it when they need it. And that's a very significant problem. So I think one of the things that we're doing in the March Times is to try to work with our friends in healthcare, our partners. ACOG has been a long-time partner of ours, working with hospitals and others to make sure that services are available. The last thing I'll just mention is that because all these issues that we're talking about today really disproportionately, again, impact women of color. Women of color, African-American women, are 3 to 4 times more likely to die as a result of childbirth. We also need to look at other ways in which services can be provided. We know that African-American women, for example, are far more likely to receive services and care from a doula, working within the formal healthcare system. And we've got to make sure that those services are also available so that women have places they can go, they can trust. They know they go to places that will listen to them and that will respond to their needs, and that will deal with their situation if they have high-risk needs as well. And what we're seeing today is that there are significant gaps in rural areas as well as in urban areas too.
Well, thank you. Dr. Coslett, Charlton, our country's facing an opioid epidemic, and especially in the state of Ohio, we're unfortunately about the 3rd worst in the country. And while Congress, and especially this committee, has done a lot of work, and we've passed a lot of bills trying to reverse this devastation, I can't help but think of the pregnant women and the new mothers who struggle with addiction. And how prevalent is opioid abuse in maternal deaths?
Well, I would comment that it is very significant, and that's why it's so important that these maternal mortality review committees include diverse members, including mental health professionals, substance abuse professionals. And I know when we established our panel in Pennsylvania, it was imperative that we had representatives from communities because that is a very significant issue. And I know Philadelphia has seen a large increase, that they've done a good job at looking at their data, almost a doubling of maternal deaths over a short period of time related directly to the opioid abuse process. And ACOG really appreciates all of the work that government's doing to make sure that pregnant women are a special population that sometimes have different needs. So the pregnant addicted mother, number one, it's a great population to invest in, because women that are pregnant that have opioid use disorders are often motivated to get better. You have a reason to get better. I mean, not that everybody doesn't, but a pregnant woman is a special population. And the other thing that we've seen is that doing not only paying attention to different prescribing needs of women as we're limiting prescriptions, I see in my state, things like that, to make the special considerations for pregnant women that may have difficulties with access and need, and to make sure that they continue on treatment during pregnancy and postpartum. The last thing is that there's special pilot projects that are coming out of these committees looking at the special population of pregnant women, and like soft landing centers where we're not separating moms and babies, and very importantly, not making punitive decisions based on maternal care, and that because we know that women that fear losing their child or going into a system are not going to seek prenatal care, and how imperative that is for the health of the woman and the child that she's carrying. So those are all things that ACOG is working very passionately on to try to improve the health care of women related to opioid abuse disorder.
Well, thank you very much, Mr. Chairman. My time's expired and I yield back.